Hi, I'm Dr. Susan Chanderban, and I'm a licensed psychologist. This is Ask a Therapist, and the question is, I've had a few panic attacks. Should I just avoid the situations I've had the panic attacks in? So, I want to talk about a few things. What a panic attack is, why avoidance is bad, and what you can do if you're struggling with panic attacks. So, a panic attack is a brief period of intense fear. It feels like something overwhelming and terrible is about to happen. There are physical symptoms in your body, your heart beating fast, difficulty breathing, almost a sensation of someone sitting on your chest, and sometimes skin tingling or numbness. Panic attacks actually aren't dangerous. They do peak and they'll eventually pass. The body just can't sustain that high level of anxiety forever. So if they feel really terrible, doesn't it just make sense to avoid situations where you're likely to have them? Absolutely not. And that sounds harsh when I say it, and let me validate also that as human beings, our tendency when something terrible happens is to look around and think about what we can control to prevent the terrible thing from happening again. In the case of panic attacks, our instinct is to look at the environment and avoid things that we associate with the panic attacks. The problem with avoidance is that it reinforces anxiety. When we avoid situations where we feel fearful or anxious, we feel immediate relief. It feels really good to avoid things in the short term. In the long term, though, avoidance prevents us from learning two vital lessons that will help us learn how to effectively manage our anxiety over the long term. The first is that whatever we're afraid of, the worst thing is likely not going to happen. In the case of panic attacks, the two typical core fears are around I'm going to die or I'm going to go crazy. And when you avoid situations where you're anxious about having a panic attack, you never get a chance to learn that those things won't happen. The second thing is you never get a chance to learn that you can tolerate the bad stuff, that the overwhelming physical sensations, the intense emotions, that they do eventually peak and they will pass and that you can tolerate them. So if avoidance is what not to do, then what should you do if you're struggling with panic attacks? 3 things. And like I say in most of these videos, they involve your behaviors and your thoughts, or what you tell yourself. First, use tools to get through in the moment when you're having a panic attack. Deep breathing. It regulates physiology. For instance, it lowers heart rate and helps you calm down. Grounding. Look around you at an object in the environment and focus on it, or a sound, or a smell, or touch something with texture. Continue in a situation. This one's important. Let the wave pass. Remember, the body can only stay in panic for so long. And finally, work on your self-talk. Remind yourself that however terrible the emotions feel, the sensations feel, that panic attacks are not harmful and they will pass.